The incidence of esophageal cancer has risen markedly over the past 50 years, becoming the 9th most common site of primary carcinoma in the UK as well as in other countries. In the past, squamous cell carcinoma was predominant, but now adenocarcinomas comprise the majority of esophageal tumors in the UK and USA. The incidence of esophageal adenocarcinoma is increasing faster than that of any other solid tumor in Western countries. Most EACs arise against a background of columnar metaplasia in the lower esophagus, commonly referred to as Barrett's esophagus. The prognosis is poor, mainly because the diagnosis is often made too late. However, the development of malignancy is preceded by increasing dysplasia in the metaplastic segment, thereby offering the opportunity for detection at an earlier stage when cure may be feasible. This is the principal argument for surveillance of Barrett's esophagus. The counter-argument stems from a common view that the majority of deaths in patients with Barrett's esophagus occur from age-related comorbidity rather than from EAC. Hence, surveillance is not cost-effective. The Department of Gastroenterology in Rotherham has a long-standing research interest in upper gastrointestinal disease and for over 3 decades has followed up the majority of its patients. This has provided the opportunity for the department to collaborate with the United Kingdom Barrett's Esophagus Register in order to review the outcome of patients with this disease. Caygill et al. Investigated whether deaths among patients with Barrett's esophagus were from EAC or from other causes. Their findings are reported in the October issue of the journal Endoscopy in their paper entitled Mortality in Barrett's Esophagus, 3 Decades of Experience at a Single Center. There is a view that the majority of deaths in patients with Barrett's esophagus are from causes other than esophageal adenocarcinoma. The aim of this analysis was to establish the pattern of mortality for a number of causes in patients with Barrett's esophagus. This was a single-center, prospective cohort study of patients from Rotherham District General Hospital, which is a secondary referral center. The cohorts consisted of 1,239 patients who were diagnosed with Barrett's esophagus between April 1978 and March 2009. Follow-up for mortality was undertaken by flagging the patients with the NHS Information Centre. Causes of death were compared with UK Office of National Statistics age and sex-specific mortality data for 1999, the median year of diagnosis. Analysis was by a person years at risk calculation from date of diagnosis. The ratio of observed deaths from EAC compared with those expected in this cohort was 25.02, a very large excess. There was no difference in mortality from colorectal cancer or circulatory disease, and there were fewer deaths from cancers other than esophageal adenocarcinoma and colon cancer compared with the national statistics. There was a small, statistically significant difference in mortality from all causes, but this disappeared completely when deaths from esophageal adenocarcinoma were excluded. The authors conclude, overall mortality in Barrett's esophagus is increased significantly, but only as a result of the large excess of deaths from EAC. This strengthens the case for endoscopic surveillance if successful interventions can be undertaken in patients with Barrett's esophagus to prevent development of esophageal adenocarcinoma.